There's a lot of other things, including compact fluorescent light bulbs, and I just looked up here, and there are compact fluorescent light bulbs everywhere, and we know that they also make people very ill. So if you happen to have them in your home, even though it's not wireless, it's something that you might want to avoid. And coming soon, we're going to have a lot more people getting sick. So what the future holds in store for us, well, we can do nothing. We can allow all of this technology to proliferate, and we're going to have probably 2/3 of the population who will be symptomatic, with 1/3, fortunately, not having any symptoms. And those are the cigarette smokers that just don't, they smoke a pack a day for their entire lives and they don't get cancer, and that's really lovely, but most of us don't fit into that. The alternative is to begin to reduce our exposure and actually go backwards in the sense of limiting how much we're exposed to and going forwards and improving the quality of our lives. I think it's imperative that we install wired rather than wireless technology in the school environment. Kids are just too precious. We don't know what the long-term effects are, and I think it's criminal if we end up doing nothing and allow this to happen. If Wi-Fi is already installed in the school, it's important to turn it off when it's not being used, just like light bulbs. Indeed, there was a calculation as to how much energy is used with wireless technology, and it's astronomical if you have a lot of wireless devices in your home or in the school. Have Wi-Fi free zones for those people who are sensitive, just like we have peanut-free environments in schools. We don't allow peanuts, we don't allow smoking. It would be really nice if we didn't allow Wi-Fi either. And accommodate and document those people who are having problems rather than just ignore them and say that they're having psychological problems. Really find out what's affecting them, because they're the canaries in the coal mine. They're telling us what's going to happen to us, and we have to heed that warning. I'm going to end on another quote. Facts don't cease to exist just because they are ignored. So I'm hoping that you'll take this information, you'll think about it, and decide how you want to apply yourself to the task at hand, which is trying to limit everyone's exposure to this radiation. And with that, I'm going to turn it over to Libby.
And now I present Libby Kelley. Ms. Kelley is the founder of the Electromagnetic Safety Alliance from Tucson, Arizona. She's been actively engaged in international efforts to address the potentially harmful effects of electromagnetic fields from a health and public policy perspective for over 14 years. Ms. Kelley worked on Public Health Act policy issues at the U.S. Department of Health and Human Services in Washington, D.C. Ms. Kelley was a leading appellate in the United States Federal Court challenging the current U.S. Federal Communications Commission radio frequency radiation human exposure guidelines. She co-produced a film documentary called Public Exposure, DNA, Democracy, and the Wireless Revolution. She co-founded the EMR network and the Council on Wireless Technology Impacts, and served as an executive director at the International Commission for Electromagnetic Safety in Italy. She was a lead organizer for the Expert Conference on Cell Phones and Health in Washington in September 2009, and she's produced several documentaries. Thank you.
Good evening, everybody. I'm so glad we could be here. Thank you for coming. When Magda was invited to speak before the Cancer Control Society this Sunday at 9:30 a.m., I said, good, that way we can do a community presentation, because I know there are so many people in Los Angeles, in the whole area, everywhere really, but in Los Angeles, who have been battling one antenna after the other and trying to figure out what to do to keep these at bay. And you know, we can't just keep fighting these antennas one after the other, one by one. We have to look for structural change. We have to change some laws. And you know, I think we're getting ready to take that action. We just witnessed in San Francisco a few months ago the enactment of a bill that was passed to require retailers in San Francisco to post information about the specific absorption ratios there. And the bill was passed over the objection of the telecommunications industry, and they're getting even, as Magda's already said, but the Board of Supervisors and the Mayor of San Francisco are standing firm. I know they are. They will not be moved. They know there's a problem. And we've been briefing them for years, and we've been to Sacramento, we've been to Washington, D.C., we've been met with governments all over the world. They do get it. They're waiting for critical mass. They're waiting for people to call for action. And it's difficult because at the same time we're embracing this technology because, you know, it is convenient. So it's a very difficult situation, but once you understand what pulse radio frequency radiation does to all living systems, once you understand it's not just about us, it's about our children, it's about the trees, the plants, it's about life, then maybe we'll rethink what it is we're doing here, because what this is a short-term solution that could have major catastrophic long-term results. And so that's what keeps me going. And it's an enormous undertaking, but I just think about it every day in a little bit. I balance my life. I have a family. I have a son. I got involved with this in 1996 because our church in Tiburon had signed a contract with Sprint to put an antenna in the church steeple. And I didn't know anything about this issue, although my father's an electrical engineer. But my instinct was no. And I spent about a year figuring out what the no meant, but I first was able to put a stop to that contract. The church breached the contract after they learned what we knew at the time, which was not as much as we know now, because they didn't want to put out the Word of God in a sacred place and be harming people at the same time. So for precautionary reasons, they breached it. And it took 7 months before Sprint went away. But that experience taught me that this is so big that I couldn't walk away, and that's what's kept me going ever since. That's why I'm glad we're here today in the synagogue. It's very important that we consider the effects on life and what we're really here for. I'd like to recognize a few people that have attended here tonight. First of all, Mary Cordero is right here. Mary, would you stand, please? Mary is an environmental consultant, and she's available to consult with people who are interested in knowing about what they're being exposed to, how to remedy the exposure conditions, not only from EMFs, but chemicals and molds. But she does know a lot about this issue. She's been trained in building biology, and she's been working on this for a long time. So welcome, Mary. And her cards are in the back if you'd like to pick one up. She knows a lot about healthy homes. Orm Miller is here, and Orm is a real expert on this issue going back for years. I've always admired his work. He's trained in building biology, which comes from Germany, where there's called bowel biology. And his cards are at the back, and he's available to speak with you. He's in the Los Angeles area. He just moved here recently from, was it Minnesota? And I'm really glad that he moved here. We need you, Orm. Also, Liz Barris is back there. Liz, I've known for a few years. Liz is a filmmaker, and she's been documenting this issue all over the world. I run into her at meetings all over the world. And she has now an organization that is a political organization set up to lobby federal and state legislation called the Cell Phone Safety Association for Cell Phone Safety, right, Liz?
American Association for Cell Phone Safety is lobbying, and then I have a non-profit which is not allowed to lobby, but we do studies, so we have taken that's the peoplesinitiative.org.
Right. And all of her information is at the back of the room, and she'll be available to speak with you. She's working on bills in Sacramento and in Washington, D.C., and consulting with the people in Maine who had a bill that didn't pass, and so Liz is very deeply involved in this issue as well. Another book, which is the flyer back there, written by Dr. Sam Milham, who's a retired public health doctor from the state of Washington. Dr. Milham has been researching the causes, the relationship between electromagnetic radiation and childhood leukemia, and in 2000 put out a report showing there was a link between initial electrification and the incidence rate of childhood leukemia. He repeated the study 2 years later using data on adults. Nobody had looked back to 1920 to see whether there was a relationship, and apparently there is. There's data that supports that link. Now he's recently discovered that he believes the culprit is not the 60 hertz field used for electricity. It is the pulsed radio frequency radiation signal that is being carried in the electrical wire, that's being transported through the wire. That's why smart meters are raising such concerns, because this signal is going to be transported through our homes, whether we really want it or not to be. There's so much more I could say, but I'd like to just go now to the petition that we've developed that I'm going to ask if you would like to review and sign. And I'm going to review it right now, and I want you to know that there are copies back there of this petition that you can take with you, have your friends and colleagues sign it, and take it forward in part or in whole. In other words, these are, we think, key points, there's 12 of them, that need to be advocated on related to this issue, trying to break down a very complex issue with an explosion of wireless equipment and devices, and hopefully succinctly articulate what is the repair, what is the fix, or what action needs to be taken. And so I'd like to just quickly review those 12 points. Again, the petition you can sign tonight is at the back of the room. You can take a copy with you. If we run out of copies, I can email them to Rena, and Rena can, or who, Rena, beside you? Would you like to be the contact point for the, okay. And then maybe we'll get them on a website too. Okay, these are the recommendations that we're making. Number one, these are the ones we'd like to address with the Congress. To revise federal telecommunications laws to restore local control over antenna siting and management by removing preemptive language under Section 704 of the Act in order to permit states and municipalities to take health concerns into account when reviewing antenna permit applications. 2, to require the FDA and the FCC to adopt lower exposure standards for cell phones and antennas. On an interim basis, while biologically based exposure standards are being developed, and once they're in place, then we'll know whether we can continue with this technology, given that we already know very low levels of this radiation is capable of causing biological and health effects. And that is a difficult endeavor. Number 3, to create a federal multi-agency program to support programs of research in experimental and clinical toxicology, epidemiology, electrical engineering, and modeling, and other relevant fields. When you realize that the Food and Drug Administration did not review cell phones before they were placed on the market in the 1980s. They do not review any products involving radiation, like Wii games, for example, that we buy for children as parents, and because we love them. Those devices have not been reviewed for safety. The assumption is they're so low power they couldn't possibly be harmed because they're far below the existing exposure standards. Number 3, to protect individual and private property rights as provided under the civil U.S. Constitution from involuntary chronic exposure to pulsed radio frequency radiation. Now, Henry Waxman, who represents this area, I understand, is chairman of the House Energy and Commerce Committee. He has the ability to hold hearings and to bring together people who are concerned about health and experts from literally anywhere in the world, and he's already stated he intends to reopen the Federal Telecommunications Act this fall because the telecom industry wants that, because there's certain things they need. Well, all decisions are born out of compromise. So if this bill is going to be reopened, and we know the bill is ripe for review because there's been so much legal activity over the last 14 years, we haven't been able to raise the health concerns in any of these cases because the Federal Telecom Act prohibits it. So that has been like the silent issue the entire time. Reviewing this law would give us an opportunity to introduce legislation to repeal 704, the preemptory language, and to set up a research program that is independent and sustained over time. We do not have that right now in our federal government. We're not being protected by our federal public health agencies. And what keeps me going is having worked for the federal government. I know there are a lot of beating hearts there, people that really care about this. They know a lot. And they're staying way beyond retirement years because they're extremely concerned, because they want to be helpful putting this all right, setting this right. And that means a lot to me.